Today we're going to do a case that I think you'll find interesting. It's actually a relatively complex case where there are 4 teeth we're going to lengthen from the patient's left central back to the first premolar. And then there's also some eroded areas on the enamel that will be building back out on the facial. And all this will be done with freehand bonding, and I think we'll get a very nice improvement for this patient. And we'll also do a little cosmetic contouring on the lower for a pretty dramatic change of where the teeth have worn unevenly on this patient. We'll deal with occlusion a little bit and end up with an overall better aesthetic and functional situation. Okay, so we've got a little pea-shaped or pea-sized portion of the microfill composite in the B0. I'll also do this in the B1. I'll just take a Mylar strip, set it across these, and push it down so that I create a polished or shiny surface on these. And then we'll just cure each one for about 10 seconds. I try to push that Mylar strip down in a way that I'll have one portion of this little customized shade tab that's thin, another portion that's thicker, so that the thickness of the material can be used to judge the shade as well. All right, now again, this template has been setting in a dark area. We place it in a drawer, and then it's carefully positioned. If you are using any sort of bite block, we want to make certain that's out of the way before we come in with this step. It's also important that interproximally, the material in the template was not over between one tooth and another. And then as that is placed, I'll use this other Cosmetic instrument, which is called a multi-use instrument, to shape this composite now. I want to allow space for the facial layers that I'll be using, but I want this to completely create the lingual and incisal. The template was trimmed very carefully to allow that incisal edge to be completely intact without having really a lip of material over that I wouldn't be able to visualize the entire incisal edge.